Testicle pain? When should you worry? You suddenly feel pain in one of your testicles. Maybe it's just a mild discomfort. Maybe it started after exercise. Or maybe you wake up with severe pain and immediately think, is something seriously wrong? Testicular pain is actually quite common, and fortunately many causes are not dangerous. But there is one condition every man should know about. It's called testicular torsion. And if that's causing your pain, waiting until tomorrow can be a very bad idea. Because when the testicle twists, its blood supply can be cut off, and after only a few hours, permanent damage may occur. As a practicing urologist, I see patients with testicular pain regularly. So in this video, I'll explain the most common causes, which symptoms are usually less concerning, and the warning signs that mean you should seek medical attention immediately. First, where is the pain actually coming from? When men say their testicle hurts, the pain doesn't necessarily originate from the testicle itself. It can come from the epididymis, the spermatic cord, the groin, or even somewhere completely different. For example, kidney stones can sometimes cause pain that radiates all the way down into the testicle. A hernia can cause discomfort in the same area. And sometimes muscular or nerve-related pain from the groin can feel like testicular pain. That's why the type of pain and how it started are extremely important. Cause 1. Epididymitis. One common cause of testicular pain is epididymitis, which means inflammation of the epididymis. The pain often develops more gradually rather than appearing within seconds. The testicle or scrotum may become swollen and tender. Some men also experience burning when urinating, frequent urination discharge from the urethra, or fever. In younger sexually active men, sexually transmitted infections such as chlamydia or gonorrhea can be responsible. In older men, bacteria from the urinary tract are often more relevant. Treatment depends on the underlying cause. One thing I often ask patients is, did the pain start suddenly or did it gradually become worse? That's an extremely useful distinction. Pain from inflammation often develops over hours or even days. But when a young man tells me, everything was completely normal and then suddenly I had severe pain in one testicle, testicular torsion immediately moves much higher on my list. Cause 2. Testicular torsion. This is the diagnosis you absolutely don't want to miss. In testicular torsion, the spermatic cord twists. That can cut off the blood supply to the testicle. Typical symptoms include sudden severe pain, usually on one side, swelling, nausea, or vomiting, and sometimes abdominal pain. The affected testicle may also appear higher than the other one or lie in an unusual position. And here's the important part. This is an emergency. The longer the testicle remains without adequate blood supply, the greater the risk of permanent damage. The best chance of saving the testicle is when treatment happens very quickly, ideally within the first several hours. So if you suddenly develop severe testicular pain, especially with nausea or vomiting, don't wait to see whether it's better tomorrow. Get urgent medical attention. I've seen one mistake repeatedly in clinical practice. A patient develops severe testicular pain at night and thinks, I'll sleep and see how it feels in the morning. That's exactly what I don't want you to do if the pain started suddenly and is severe. With many urological conditions, waiting several hours doesn't make a major difference. With testicular torsion, it potentially can. Cause 3. Trauma. Sometimes the explanation is obvious. You were hit during sports, had an accident, or injured the area. Minor injuries often improve with time, but significant swelling, severe persistent pain, a large bruise, or pain that doesn't improve should be evaluated. In some cases, ultrasound is needed to make sure the testicle itself hasn't been seriously injured. Cause 4. Varicocele. Another common condition is a varicocele. These are enlarged veins around the testicle, somewhat similar to varicose veins in the legs. They're much more common on the left side. Instead of sudden severe pain, patients often describe a dull ache, heaviness, or discomfort that becomes worse after standing for a long time or exercising. Some men even describe the veins as feeling like a bag of worms. Varicoceles are usually not an emergency. However, They can sometimes be associated with fertility problems or testicular discomfort and may need further evaluation. A pattern I hear quite often is, "It doesn't really hurt in the morning, but after I've been standing all day, I notice a pulling sensation in the left testicle." That pattern is completely different from the sudden severe pain of torsion. How the pain behaves throughout the day can give us useful clues about the cause. Cause 5. Kidney stones and referred pain. This one surprises many patients. A kidney stone can sometimes cause pain in the testicle, even though there is absolutely nothing wrong with the testicle itself. The pain typically begins in the flank or back and may travel downward toward the groin and testicle as the stone moves through the ureter. Patients may also experience nausea, vomiting blood in the urine, or a sudden need to urinate frequently. So if your testicle hurts but the examination and ultrasound are normal, sometimes we need to look further up the urinary tract. What about testicular cancer? This is one of the biggest concerns men have. But here's something important. Testicular cancer usually doesn't present as sudden severe testicular pain. The more typical presentation is a painless lump, swelling, enlargement, or change in the consistency of the testicle. That doesn't mean pain completely excludes cancer. It doesn't. But sudden severe pain has other diagnoses that are usually much more important to consider first. If you notice a new hard lump or persistent change in one testicle, get it examined even if it doesn't hurt. This is something I really want men to understand. Pain is not necessarily the symptom that should make you think most about testicular cancer. A painless hard lump can actually be more concerning. I've had patients delay seeing a doctor because they thought, "It doesn't hurt, so it can't be serious." That's not a safe assumption. Any new persistent lump or enlargement of the testicle deserves an examination. How do doctors evaluate testicular pain? Usually, we start with your history and a physical examination. Depending on the situation, we may also perform a urine test, STI testing, and an ultrasound of the testicle. Ultrasound is particularly useful because it can show the structure of the testicle and assess blood flow. But if testicular torsion is strongly suspected, the priority is rapid treatment. You don't want unnecessary delays when the blood supply to the testicle may be compromised. So, when should you worry? Seek urgent medical attention if you have sudden severe testicular pain, especially if it is associated with nausea or vomiting, rapid swelling and unusually positioned testicle, or severe abdominal or groin pain. You should also see a doctor if you notice a new hard lump, persistent swelling, recurrent pain, fever, urinary symptoms, or pain that simply doesn't go away. Conclusion: testicular pain has many possible causes. Some are relatively harmless. Others require treatment. And one, testicular torsion, is a genuine emergency where time matters. So remember, sudden severe testicular pain should never simply be watched overnight. And don't forget the other important message: a painless lump also deserves medical attention. If you found this video helpful, please like the video and subscribe to the channel for more straightforward urology information from a practicing urologist. Thanks for watching, and I'll see you in the next video.